for our Welcome to the Country, and you are joined by?
My granddaughter Isla.
Granddaughter Isla.
Granddaughter Isla. I have another granddaughter, Nellie, so they're not identical twins. I will do introductions to my family while I'm here actually. I have my granddaughter over there and my daughter. It's important for me to do that because we're 4 generations of strong Noongar women, so I'm extremely proud of that, and I always take the opportunity to show people how strong we are as Noongar women. So I'm here to do the Welcome to Country. Hello and welcome. Balarang Nama Kaya, Luna Kunja Roja Nga Buja. Welcome to all of you here today in all in our land. The protocol for introducing oneself to Aboriginal and Torres Strait Islander people and non-Aboriginal people is to provide information about one's cultural location and family, which I've just done, so that connections can be made on political, cultural and social grounds, and relationships can be established, which are extremely important. Following this protocol, I introduce myself within this space. My name is Cheryl Taylor. I belong to the Balladong Wadjak clans of the Noongar Nation. I'm a mother of 3, a grandmother of 10 grandchildren, a great-grandmother of 8. White people who thought they discovered our country named it many other names that had no connection to the spirits of this Budja or our land. The rivers of Perth are featured in many dreaming stories of the local Noongar people. For Noongars, the Swan River is not called the Swan River, it's called the Derby Yerrigan, and I'm sure many people in this room call it the Derby Yerrigan. I just want to give a little bit of background information about the East Perth area, given that that's where we are meeting today. And the information that I've collected is from a Noongar historian named Collard. And these are some of the things that he has written about in the past. During the Depression and the collapse of the rural economy, Noongars were forced to leave from the country in search of work, with many families settling in and around the East Perth area, which is very inclusive of all my own family. If some of you are old enough, you can remember the Jack Davis Hospital. Jack Davis was my mother's brother. He was a famous playwright, and that is my lineage to Jack Davis. Restrictions existed from 1927 until 1954, so that any Aboriginal person needed a permit to enter the city, and Aboriginal employees would be arrested if they were without their permit after the 6 p.m. curfew. There were several significant locations near the East Perth Railway Station, known as the Bull Paddock and Miller's Cave, which had been part of the old Miller's Timber. My parents and uncles used to talk about these 2 places quite often. I spent quite some amounts of time there. The Bull Paddock East Perth, this was an open space just south of Claysbrook, often used by Aboriginal people camping and socialising in and around East Perth throughout the 20th century until the East Perth redevelopment work happened. This and adjacent areas were also important places where Aboriginal people camped when they missed their trains home to their camps and homes, out in places such as Bassendean and Bayswater. Another important story of Aboriginal people in East Perth was the formation of the Coolaboo League in 1946. Dances were held every Friday night, which many Aboriginal people attended, including my own mother and uncles. During the 1960s, there were between 175 and 200 Aboriginal people living in East Perth. As a consequence, there was a strong sense of community amongst those and Aboriginal people living here. At this time, various church and non-government welfare organisations started providing support and setting up operations in the area. Just to continue with my story, I am of the rivers and the tall trees. I am Noongar. I was born in the 40s, a time when government separated Aboriginal children from their families and country. My parents taught me not to be afraid to speak the truth to anybody. By that, I mean we all need to focus on building a nurturing, ongoing relationship between Aboriginal and non-Aboriginal peoples in all our aspects of work. Many times I've been given the responsibility by women and elders in my community to talk at these events. This forum is an extension of my communal responsibilities. I am representing a senior women's standpoint in the mainstream Australian space. My role accorded to me in this space is inextricable from my embodiment as an Aboriginal woman, as with my younger generations. I acknowledge and thank the ancestral spirits of all the elders from all the clans that cover this beautiful country on which we all have the privilege to work and on which we are gathering today. I am indebted to many of the elder Noongar women who have gone before me and who walk beside me, whose spirits carry me and who continue to protect, nurture and sustain me. They created a path on which we can all walk together. My love and appreciation go to my grandmother, mother and all my aunties, all who have passed on but still continue to inspire and teach me the importance of life. The challenge for the future is to embrace a new partnership between Indigenous and non-Indigenous Australians. The core of this partnership for the future is called Closing the Gap between Indigenous and non-Indigenous Australians on disability, life expectancy, education achievement and employment opportunities. Today is a journey towards the ongoing need to work together to address these issues. I welcome you all. Thank you.
Thank you so much. And thank you for joining us on stage. The intersectionality that Cheryl just mentioned, that we're not just this one thing that we bring to the table at any given time, really resonates with me in how I think about the acknowledgement of the people who've been on this land for so much longer than I have, but it also speaks to the removal that I myself have experienced as an inter-country adoptee, where I was taken from a country and moved to another one and had no connection to the culture of those lands anymore, and that feeling of being without health history, without family history, that sense of removal and then being rewritten is something that gives me a deeper level of empathy when I acknowledge it, which has been very difficult for me to acknowledge that throughout my life because it hasn't really been an issue. And I think that during the pandemic and when Black Lives Matter re-emerged, not new, wasn't new then, but when that re-emerged and took a big place in the hearts and minds of my fellow citizens, it really did ring a bell for me to get a bit more involved in whatever I could with adoption circles as well. So working with adult adoptees is something that I took away from that, which is we're also human beings who've been removed from a place and put somewhere else and told, be grateful. What are you complaining about? So I think it's on all of us to think of the other parts of our lives where we've been othered, removed, made to feel less than, and our right to actually be operating on this land as equals with everyone else who's here. And I think that's something that the Health Consumers Council has made really, really clear following the results of the referendums, that this is an opportunity for us to think more deeply about what our connections are to each other, about how we do acknowledge those who went before us and upon whose shoulders we stand now. One of the acknowledgements we also do at every meeting at the Health Consumers Council is also a lived experience. And I think it's almost a term that gets thrown around a lot now as a way to get through that door, is that, oh, well, I bring this lived experience to the table. As someone who ticks lots of boxes, Lived experience is a qualification, an asset, and it's something that's really important for us to acknowledge in our governance through the Health Consumer Council Committee of Management. The lived experience of our members, who not a board or committee management. We acknowledge that we have lived experience at all levels of the organisation. They are our advocates, they're our management, they're on the committee of management, they are our members, and we acknowledge what it takes to get up and face your day when you are bringing your health experience, all that's good and bad, to the table, and that your needs are either not being met or we're here to support you to get those met. So I'd like to just acknowledge the lived experience that we also have at Health Consumers Council. Thank you so much for welcoming us. Thank you for bringing your young ones and for acknowledging the women who are the many layers of the story that you're bringing. Thank you. To Anne, yes, because we're not going to someone who's away and Maxine going to speak. That's right. Welcome, Anne. Thank you. Foundation member.
Thank you. Welcome everyone, and thank you, Auntie Cheryl, for welcoming us, and also thank you for you and your ancestors for looking after this country and welcoming us here. I think I would speak for most people in this room, if not all, that we appreciate that, so thank you. And good luck to those two little ones in the future. Nice and loud, I'm being told. Okay. I know there are members of Parliament here, but I'm hoping the Minister knows who they are. And she... What? Right, huh?
No, don't try COVID like that. Sorry.
Okay. Can you hear me now?
Yes.
Yeah. Welcome again. Coco Chanel said, "To achieve great things, we must first dream." And Health Consumers Council is a collection of people who dreamt of wanting and having their voice heard in issues of health. It's about people. It was about the people that were involved there at the beginning. And one of the people here is Mitch Messer, who I think should have been up here with me as well, because he was vice chair, or I was chair. We kept swapping for a while. We were treasurers as well. A bit of history for those of you that haven't had the opportunity to see the poster and the room. Keith Wilson was the Minister for Health in the early 90s, and he set up the Health Advisory Network. And that network had consumers, consumer organisations, I don't think there were any individual consumers, consumer organisations and service providers. The people that were part of the founding of this organisation conceived the idea and progressed the issue of having the consumer voice. It became the Health Consumers Network, and then with the support of Minister Peter Foss at the time, and the DG, Peter Brennan, who supplied some project support with George Dramatis, and the driving force of the members' special interest group, the Health Consumers Council was born. Our birth certificate is dated the 1st of January 1994, otherwise known as our Constitution. Our inaugural general meeting was on Thursday the 10th of March 1994 at 7 o'clock at Gracethorne House. And the board, the inaugural board then were myself, Mitch Messer, I don't know where you are, Mitch, but you should really stand up. Mitch Messer. He did his regal way. Noreen Hartley, Pamela Howell, Elizabeth Burrell, Margaret Fergie, Tessa Jupp, Peter Lammas, and Bernice Teal. We then had our reveal day. on World Health Day, the 7th of April, 1994. So that was yesterday, was our reveal day. Today we're celebrating 30 years, a Pearl anniversary. Those little bits of irritating grit that were around then in the form of people I've mentioned have ended up forming a pearl. So we can either have a birthday or we can have a pearl anniversary, whichever people are interested in. The mission said, amongst others, that we were going to contribute to the health of the people of WA by providing a voice and recognised presence for health consumers. We had a board, we had a constitution, we had some funding, we had some premises, so next we needed staff. Steve Jobs in 2002 said, "It doesn't make sense to hire smart people and tell them what to do. So we hire smart people so that they can tell us what to do." And they did. Sue Taylor was our first office manager. We then employed Michelle Kosky, who some of you may be aware had a car accident in order to get out of speaking today, which is left that to Maxine. And Maxine Drake was the third appointee. Later on, we had the Mental Health Project, and Pat Latter, Deb Waddingham, and Sean O'Connell. And Lloyd Marsh was first. Sorry, you should tell me what to do. That's why we employed smart people. And Lloyd Marsh. And Lloyd was involved with the Mental Health Task Force in 1994 and got on the table that we had to have a mental health law centre, which those working in mental health will know that's was successful and it's now part of RUA organisation. In the intervening years, we moved office from Gracebourne House to Lord Street, then we moved round the corner in Lord Street, and then we moved up the road to Lord Street. So we keep a bit of it consistent. And we built on those original objectives in the mission. We've had some success, some are still progressing. My final quote, Bill Gates recognised that we all need people who will give us feedback because that's how we improve. And what's fantastic this year is to see that sometimes the value of that feedback is acknowledged in very, very significant ways. This year, the Royal Australasian College of Physicians are awarding an honorary fellowship for Deb Letiker for her work in the consumer areas, consumer rep. Now I know Deb is here, she'll probably be embarrassed if I ask her to stand up, but and I did ask her permission to say that publicly, I didn't want to embarrass her. But for the college to see the significant influence of a consumer rep there and who's made changes, that's just wonderful. There are still areas where it's not so good, and thinking about today, I decided we were like Gaudi's cathedral in Barcelona, de la Sagrada Familia. We're still a work in progress. We still need some resources, and Bob is somewhere, Rob is somewhere, who's the Assistant Director General who looks after the money and health. I'm targeting you when I'm saying that. Please, we need some resources to finish this cathedral. And, help us build a wonderful, even better organisation than we've got today. And finally, just thank you to all the people that have been involved over the years. Some of them, sadly, including Sue Taylor, is no longer with us, and some of the other people, but we appreciate the foundations that they've left. And left for us to build upon. So thank you all for coming. And we could burst into happy birthday, but we leave that for the end. Thank you.
Hi everybody, I'm Maxine Drake. I'm an advocate, and I became an advocate at the Health Consumers Council pretty much by accident because people kept ringing in and we listen and we find ways to help, and that's really what advocacy is. Michelle Koski, has done some field research in the health system, and so she's not available to be here today. I've always seen the world as commerce, government and the community sector, and the community sector mobilises to meet the needs that commerce and government can't. And the Health Consumers Council is a classic example of that. I was there for 16 years and I can get all sorts of accolades for how fabulous I might have been doing what I did. But I was on the payroll. I want to say that it's the adults who were around at the time, and I've never seen myself as one of those adults. Adults go into politics and deal with the responsibility and handle the outcomes. I can just work and have other people make decisions. So the people who were around at the time, the grown-ups around at the time, knew that something needed to happen to tip the balance away from the establishment in the health system, the medicos who were self-regulating and getting away with all sorts of things, tipped that balance more in favour of consumers and started the consumer movement. The consumer movement starts all over the place, like the queer movement does. Like every movement starts all over the place, and people take it up or not. We in WA are very lucky to have consecutive governments just see the benefit of this. Other states do not have such a magic entity as the Health Insurance Council. And so we just commend the bipartisan support that's always been provided to the Health Consumers Council, but it also took smart leaders. Michelle Koski was a savvy individual. I used to go along to meetings with the Commission with Michelle, and she'd just tuck her head into her shoulder like a magpie and tell the Director General what he needed to hear about what wasn't working in the system. And it was spectacular stuff, and worked very well with the board to bring them up, to keep the legitimacy of the organisation as not just the worker, not just the paid CEO, but the people on the board. The people on the board of the Health Consumers Council have always been really, really important because they legitimate the enterprise and keep it connected to the community and keep its authenticity. But so those grown-ups choose people. I don't know who chose me, Mitch, and on my selection panel, God knows why. And then we work and we do the work of the organisation, but it is the board and it is the CEO generally who lead. We had some fabulous workers who also helped to establish the culture of the organisation. Sue Taylor and Rosemary Caithness were both on the reception for a very long time. Both are no longer with us, but need to be acknowledged. Steve Roebuck as well was on the front desk and was the front of the organisation, and advocacy emerged as an activity of the Health Consumers Council like it hasn't in other states as well, and has been supported by the Health Department. So you could ring and you could get a doctor to say, anyway, who are you? And you'd say, well, we're funded by the Health Department to assist this person. Oh, okay then. And so the funding from the Health Department made it possible for us to do this work, and we weren't compromised in our independence. We could still keep our independence, and that's the big argument against government funding, but I've never bought that argument. So I want to thank every single person who's ever backed this organisation, especially those who've done it out of their own civic time, yeah? Because they're the ones that really made this important entity happen and keep it going. Because those of us on the payroll, we can be great at what we do, but really, it is the people who keep it going out of hours when I'm off doing whatever I'm doing that are really the ones who matter. So thank you very much. Thank you to government. Thank you to all my elders. Because sorry, Mitch, you're my elder, 2 years older than me. You lose. And for everything that you've done to make this organisation what it is. Thank you.
Thank you. So yes, I'm Clare Mullen. I have the absolute privilege of being the Executive Director at this moment in time. I've just got the microphone very briefly for now, because what we are going to do, as Anne said, I got a text from Michelle on Saturday describing what lengths she's gone to not to be able to be here. So she's had an accident. She texted me this morning to say that she wishes us in spirit and she wishes us well. And now, by the magic of technology, we hope we're going to have an audio message from her.
Hello everyone, this is Michelle. I'm really sorry I can't be with you this morning, but I hope the event goes very, very well. I was going to use my marvellous speech to thank all of the people that have contributed to the success of the Health Consumers Council over the past 30 years. In particular, board members, HCC members, a marvellous staff, and the Department of Health who believed in us over all those years. And I think in a way that's quite rare. So, a great celebration and congratulations. Thank you.
And so now we're also going to hear, we've got a few messages from people. You're seeing a bit of a sneak preview of a short video, which we, again, by the magic of technology, is going to appear on a wall. And we can't close the doors, because, yeah. So, it will be available on our website after the event. I wonder if someone at the back can turn the lights off. There we go. And talk amongst yourself. Actually, what I would like to do is, if I can take a moment, and while we're getting ourselves sorted there, is I would like to take a moment to say thank you to Auntie Cheryl for that beautiful welcome to country. As Mallika mentioned, at Health Consumers Council we were originally established, and one of the things it said was to be a voice for the community on all aspects of health. And since the referendum result, we have really been sitting with what does that mean in a post-referendum world. And one of the things it means, and I'd like to also acknowledge Kerry Colgate, who has been working with us to Auntie Cheryl's daughter, to help us rethink some of the traditional rituals that have perhaps become a little bit of a kind of like, well, that's what you do, isn't it? That's how you start an event, so you do that. And I know I arrived on this part of the world that we now call Australia about 18 years ago, and it was several years before I realised that a welcome and an acknowledgement of country didn't have to be the same words all the time. That you could, in fact, acknowledge country with heart and meaning. And that was a revelation to me, and I am on a journey of learning, as is the organisation, and continue to be on a journey of how we can use those rituals that are in place for a reason, that we may perhaps have moved away from as they have become so just part of how we do things. So I guess I just wanted to particularly acknowledge Auntie Cheryl the time, and I know we've worked in advance to try and make that something that, as my colleague Tanya Harris, who's also here, has spoken about, the real gift that it is to be welcomed to country by someone who has a strong and enduring connection to this part of the world. So thank you. Thank you.
Metropolitan Health Service, our vision is to provide excellent healthcare every time. We aim to be the public health service of choice for our staff, patients and community. I'd like to recognise the significant contribution the Health Consumer Council has made towards embedding the involvement of consumers and carers in the planning, delivery and evaluation of our services.
It's a privilege to share this important milestone with you, celebrating the 30th anniversary of the Health Consumers Council of WA. At PACWest, we aim to provide our patients as health consumers with an excellent experience every time. Whether providing pathology in Kununurra or Kalgoorlie, in the suburbs of Perth or in a remote community, we aim to deliver care that aligns with the Health Consumer Council's vision across this great state of ours.
I think the Council has had a really strong impact and a really big impact on the healthcare in WA. When the Council started, it started by wanting to be a voice and I guess being a squeaky wheel and always raised the fact that health services should be for the people they're aimed at, not for the providers of those healthcare services. And I think that one of the impacts can be seen, the fact that during the Sustainable Health Review, the Health Consumers Council had a seat at the table and was the Executive Director at the time was a part of that. And 30 years ago, there would be no way health consumers in Western Australia would have actually been a part of a review of health services. And I think that's a really strong and important message that we can have, the impact of people.
For me, what stands out from my involvement with Health Consumers Council is I got to experience the privilege of working in a values-driven organisation. The culture and morale at Health Consumers Council fosters an environment where employees feel connected, motivated and proud to be part of something so meaningful. At Health Consumers Council, values matter and form the bedrock for everything it does, from interpersonal and community relationships to every decision made, large and small.
Some of the most important contribution the Health Consumer Council has provided WA is the establishment of the consumer association, consumer-led associations in each and every hospital in WA. This has given the consumers a seat in the provision of health in Western Australia. This is something that I think has more or less made the voice of the consumer part and parcel of the delivery of services.
For us, your impact has always been the independent voice. Your values ring true today as they did 30 years ago. Yet you've always been courageous enough to tackle the big ticket items, yet representing people who are disadvantaged and vulnerable.
My fondest memory is perhaps when the previous CD, Michelle Krosky and myself appeared before a Senate inquiry into the future of Medicare.
Probably the most wonderful memories I have of the Health Consumers Council is the shared advocacy we took, particularly around mental health and all the sub-networks with the mental health network. Just absolutely invaluable. But I can say they were always an incredibly reliable organisation to go to get up-to-date information on a whole range of policy areas.
I've been involved with the Consumers Council for more than 10 years now. Started with a cup of coffee with Pip and a promise that one way or another we'd find a way to do things together, and we have certainly done so in this period.
I joined the Health Consumers Council shortly after it commenced in 1995, and since then I suppose the big standout things for me have been the absolute mentorship and support and encouragement from firstly Michelle Krosky and then Maxine Drake and Pete Brennan, and so the list goes on. And I think it's not only been for me in my work life, but it's also been for me as part of my family. I've navigated various aspects of the West Australian health system, and I've from time to time sought help from those within the Health Consumers Council.
I just think that the Health Consumers Council has been so important and so instrumental in making sure that health consumers are at the decision-making table in our health services, that we've just got this longevity of experience and commitment, and I'm just really looking forward to seeing what's next.
So thanks to you for all the work you've done. I've no doubt you'll continue to be a strong voice for both patients and the public over the next 30 years too. And if we in the health system, including the public health system, can learn to listen just that bit better, I think we'll all benefit.
Now, we together understand the absolute importance of making sure health consumer voices are at the centre of health services and health policy and every part of that health system. And that is the excellent work that every member of the council does. Often unseen, often uncelebrated, but tonight put up in lights. Thank you so much for everything you do. As a Green, as someone who loves WA and is so passionate about good, universal public services, and they only happen if they are consumer-centred in their delivery and in their creation. Thank you so much, and let's go forward to another fantastic 30 years.
Thank you very much to everyone who took a time to share a message with us. And now it gives me great pleasure to invite Minister Sanderson, who is the Minister for Mental Health and for Health, to say a few words.
Thank you. I've been doing the job of acknowledging the members of Parliament in the room, so I'm quickly looking around. Before I do that, of course, we acknowledge that we are one Wajak Noongar land. I pay my respects to their elders, past, present, and emerging, and thank you for the welcome this morning, this afternoon, and for meeting your delightful granddaughters. It's a pleasure. And of course, I can see Honourable Brad Pettit, NLC. I've seen former member, parliamentary colleague, the Honourable Martin Whiteley, who has also been very active in the Health Consumers Council. I had Libby Metten on my list. I'm not sure if she's here. There's Libby Metten, the leader of the Liberal Party. I hope I haven't missed everyone. If I have, apologies. So, of course, thank you, Mallika Macleod, current chair, and Clare Mullen for pulling together today this important happy birthday for the Health Consumers Council. And, of course, we have to do so by acknowledging the Honourable Keith Wilson, who's unable to be here. I'm very fortunate to follow in Keith's footsteps, both locally to represent Noongar and Dianella, but also as Minister for Health, and he was instrumental in politics, in particular, in really putting consumers at front and foremost of healthcare from a political perspective, I think. So I have to acknowledge the great work that he continues to do, actually. It's certainly not past, he certainly continues to do that. Very pleased, of course, to be celebrating the 30th birthday of Health Consumers Council and to hear from so many voices of the past. And I think the fundamental question really, you've got to start with why. Why the Health Consumers Council? And why do we need one? Why do we have one? And why is it so important that we have an independent organisation in Western Australia? And the fact is that harm has been done and can be done in a healthcare setting. And it's important to acknowledge that. Whether that's if the setting is culturally unsafe, clinically unsafe, whether it's unsafe for people who are experiencing a whole range of life experiences, we are always improving the environment and the experience that we need to provide for our patients. And I think often healthcare is designed and delivered around what the system needs, where it's going to be, where the doctors are going to come. Will the doctors work here? Will we get enough doctors? Where will the staff want to live? Where will the staff park? And you can't run systems without any of those elements. But often what is not front and centre is, well, what do the patients need? And what do consumers need? And often that's something quite different to what systems necessarily need, or healthcare workers. So we do centre, in Western Australia, we centre the majority, well, probably more than most states, the majority of care goes through tertiary hospitals. Other jurisdictions don't put as much care through tertiary hospitals, and anyone who's had a relative in a large tertiary hospital knows that requires hourly, daily advocacy for that loved one, particularly if they're frail and vulnerable.
And that's why there are a number of really important reforms going on in the health system in Western Australia, and many of which have been promoted and championed and advocated for by the Health Consumers Council. One of those, of course, is the Sustainable Health Review. Well, it's a multitude of reforms, but the umbrella really is the Sustainable Health Review. Part of that is also what we're calling the emergency access reforms, which is really actually about providing alternative pathways than an emergency department for people with mental health crises, for people from aged care or older Australians who need access to care quickly but don't need to be in an emergency department. And every one of those reforms is centred and based on patient feedback. So it's important that clinicians are engaged, and it's important that the sector's engaged, but we evaluate every one of those reforms based on patient feedback. And the WA Virtual Emergency Department is a really good example of that, where we're starting with older patients in aged care who don't need to be in a hospital setting, and it's not a good place for them to be, and making sure that their patient experience and their family are comfortable with that experience, so that the outcomes are better for them. We've seen the evolution of mental health. It's moving from highly clinical, hospital-based inpatient care to multidisciplinary teams with lived experience at the table when we're developing these services, and peer workers now in the public system, which has been a challenge in the public system. We're now employing peer workers with lived experience to work with people having mental health issues and on their recovery journey. So the Sustainable Health Reviews remains part of the government's vision for healthcare in Western Australia, and it's challenging to deliver. We're still very committed to it, but we see an increase in demand, particularly from our older population, on our health services, and the reality is we can't continue to build the bricks and mortar, the beds, and produce the staff required to just continue building more hospital beds. We have to be providing alternative methods of care, and that's what this government is focused on doing. So I do want to say congratulations and thank you to the advocates in the room, because these changes, the governments implement the changes, but they're not always our own good ideas, and many of them come from decades of advocacy and hardship, in fact, through mental health, through disability reform, through law reform, and through health reform. And it's about acknowledging that hardship and acknowledging the harm that can occur in healthcare settings. And we continue to work together as a public system with the Consumers Council, with our clinical workforce, to provide a setting that is not only clinically safe, but that is culturally safe, that is safe for people, LGBTQIA+ community, for people experiencing mental health issues and homelessness, and safe for our multicultural community. And I think the best way that we do that is to have a workforce that reflects our community, that reflects what our community looks like, and we continue to support that through training. So thank you, Health Consumers Council, and congratulations on a great 30 years, and we look forward to the next 30 years.
Thank you very much, Minister, and thank you to all the speakers and to the people who gave their tribute. And in fact, I have a hold on a second. A small gift here to say thank you. Cheryl. Okay, so I have as I said before, I have the privilege of being in this chair, in this role, at this time, in this moment, and I have to say, like I say, I say my thanks every day. First of all, for having found myself on this part of the planet, I have to say. I would never have expected myself to, when I was growing up, I had no ambitions to move countries to this degree, and here I am on this world, on this land that we now call Australia, and I'd like to add my acknowledgements. And and say thank you to the many people who have gone before, and acknowledge that we're still seeing and living with the impact of colonisation that's felt by very many people today, and our part in helping to address that. There are so many people in the room that I want to say hello to and thank you to, and if I did that, well, we're here till 3, right? So, no, don't worry, I won't keep you till 3. But I did just want to take a moment and enjoy this space. First of all, how lucky are we? We are in this space. I don't know how many of you know this, but when we started to look for where could we have an event that would do justice to the kind of feel we wanted, but also enough people, we had a bit of a look around, and Perth City Farm is also 30 years old this year. So 1994 was a big year in Perth, so Perth City Farm are also celebrating throughout the year, and we thought it was a great opportunity to connect our stories. I would like to also acknowledge that I really do feel, and I know all of the team feel, that we really are standing on the shoulder of giants. There are very many people who have come before, and you've heard very much about their history. But I also then want to just take a moment and look a bit forward. So all around you, you'll see the faces and the names and the work, as many of the speakers said, as the Minister said, those people who are championing change, agents of change, drawing on their lived experience, their community connections, and as you said, Minister, it can make such a difference having a strong and powerful advocate in the room with you. And I know from hearing from many consumers about, and you'll hear, we've put up some quotes that people have shared with us, the difference that it makes to have a trusted, confident consumer advocate, just even in the room with you, may not even have to say anything, but just being present. And acknowledge the difference that makes. I guess I also just wanted to reflect, I don't know, I either invite you to think forward to what your 30s might be like, or if you're maybe beyond your 30s, think about what your 30s were like, or if you're in your 30s, think about what they are like. And say, like, so again, up until now, it's a little bit of a period of growth, and learning. These really are the years where you kind of consolidate and you move forward and you build on the wisdom and the knowledge and the experience that you've gained to go forth and make your place in the world. And while Health Consumers Council, from what you can see around you, has clearly already done that, I am really looking forward to working with all of you here in various ways to see what comes next, as so many of you have said. So I think if you haven't already had a chance, outside we're inviting people to share some of your thoughts and ideas for what you might like to see with regards to that partnership between consumers and clinicians and others who work in the health system. And we're calling it a time capsule because when we were doing it at City Farm, we thought, we could bury a time capsule. But it was understood that wasn't that practical, and so we're not going to bury it, but we are going to put it somewhere safe for 10 years. And so we'd like to see you all back again in 10 years. As we celebrate and we see how much of that we've been able to bring to being. And then alongside that, there's a pledge tree where we invite you, because we cannot that's not a task for any one of us here. It's a task for all of us, and so we invite you to share your pledge for what your role might be in helping to bring about the future that you all are part of and want to make happen. Hold on a second, I'm just going to check. I'm no longer in my 30s, but I do need my reading glasses. Hold on. I guess the only other thing I wanted to say is that, as many people have said, and as Mitch recognised in the message about the Sustainable Health Review, that being involved in that work right from the start, and for it not to be thought to be done without having consumers involved, is a great testament to the work that's gone before. And I think, if anything, we've recently just revised our strategic plan. For those of you who want to have a bit of a look, it's on one of the panels at the back. And we've handily laid out what we're going to manage to achieve within our current funding, and all the things we'd love to do if we had more. So just encourage you to have a look at that, if that's of interest. But I think the main thing I'd say is it's going beyond now that consultation paradigm. And I would pay homage to the work that the Health Department have done with the Emergency Access Reform Programme, with the electronic medical record, there has been a commitment to go beyond the consultation paradigm into partnership and leadership, and that's reflected in our new strategic plan. And so I would like to just finish off by saying a huge thank you to you all for being part of the journey so far, and look forward to being part of the journey with you into the future, and who knows what it will bring. I think it's going to be interesting as we see things like virtual emergency medicine, compassionate communities, social prescribing, which are going to really change the nature of the relationship between what we think of as consumers and what we think of as providers, when many of us are already involved in that, in delivering care to family members or support. So I think there's going to be a blurring of the lines between, if you like, provider and the people who experience the provision of care, and I'm really looking forward to being part of that journey with you all. So thank you very much, everyone. We're going to do some cake cutting in just a second. So there is cake, so hopefully you're going to stay around for some cake, or cake. I should say that in Australia. There's some cake. So I'll invite you to join us to continue the celebrations. Please enjoy this space. I think there's a bit of a breeze outside and there's plenty of shade. So there are gluten-free options. This cake here is not gluten-free, but we're going to do a bit of a cake cutting and then invite you to enjoy each other, enjoy the space, and thank you very much.